Good morning, Mark Pfister, Executive Director at the Lake County Health Department. And so I first wanted to start off this morning by thanking the City of Waukegan and the Village of Gurnee, that we've had very good conversations with them. And Lake County, the Village of Gurnee, and the City of Waukegan, we have solidarity to accomplish something that US EPA and the IEPA are not doing in Lake County, which is ambient air quality testing. So our goal is to protect our residents in Lake County. And so the three entities, our goal is to get that to happen very quickly. So before I go into the testing, I did want to say that what Dylan brought up earlier is something that we are lobbying for also, and I would recommend that this board support that we get the Illinois Department of Public Health to come in here and actually do a cancer incidence study. I did talk about this at HCS last week. And so this is something that we are trying to get IDPH to come in and do now. They're also looking to expand that to other sites beyond Gurnee and Waukegan so that they have a better comparison as to what's happening with ETO around different areas so that we can have a better understanding. Secondly is that to Dylan's comment, excellent comment about what happens after we finish gathering this information, we have these tests, what will be done then? Is that I've also petitioned ATSDR, they're an arm of the CDC, to do a health risk assessment based on the ambient air ETO tests that we are going to be conducting very soon. So, going to the air testing is that we've been working very closely with the US EPA. So the good news is even though they have not been providing any air testing or talking about doing any air testing in Lake County, that we've been working with their scientists, with their staff that do this, and they are experts on coming up with sampling monitoring plans. And so what we released yesterday, because there was uncertainty out there in the public, and there was information that was saying that we were only going to be testing 2 sites per location just last week. So that was something that we wanted to make sure that we got out to the public yesterday so that people knew the direction that the 3 partners were going. So with regard to this testing, what's going to happen is that, so there's 4 sites at this point in time planned that will be directly around Medline. There'll be 4 sites directly around Vantage, and then we're going to have 2 remote sites. Okay, those sites are going to be selected by science. So what's going to happen is US EPA is going to help us model where the best locations are to put out our sampling sites. And so they're going to be looking at wind rows, it's called, and so we have Waukegan Airport that has a lot of data that shows historical wind direction, wind speed. Where you place these sampling sites is that you do not want to put them near, for example, if you have a large forest preserve with a large stand of trees, that's not a location you want to put it. You don't want to put it near certain buildings that may block the wind patterns. You want to have very representative sampling. So the bottom line is that this is our initial plan. Once US EPA conducts their modeling, this is something that we will look at, those sites, and also discuss with the partners, do we have the most appropriate sites to gather this information? The other thing I wanted to point out is that this is a 30-day testing, so that there's going to be a sample taken once every 3 days. So you're going to have, so it was just mentioned that there was only going to be 11 canisters. We're going to have over 100 samples, okay? So that is, you're going to be taking a sample at every location every 3 days, so which equals to about 11 samples per sampling site. So that's where we're at this point in time. So we're working very closely with US EPA to do that modeling, to really have a very good understanding of where the sampling sites will be placed so that we have representative samples being taken.